I just got off of a call with a really amazing group called Protect Our Care, and I want to talk really briefly about healthcare because I know that we keep talking about how, oh, the economy is so important, and everybody is rightfully very worried about how much money they have in their wallets. But healthcare is one of those things that will take all of the money out of our wallets if we're not paying attention and bad policies get put in place. This is one of these areas where people who say, politics don't affect me, I don't care about politics, suddenly when they get a giant hospital bill or when there's a health crisis in their life, realize, oh, you know what? Politics and healthcare are like inextricably combined. And so I know, because I sit in these meetings all day, every day, that healthcare under a Trump-Vance presidency is so endangered. I can't begin to explain the many ways our healthcare system is going to take a giant hit under them. But I attended a call today specifically because I really wanted to understand what will happen to the ACA, a program that has now been around for long enough that we all kind of take it for granted. Oh, the ACA, it's just going to be around. We take for granted that young people get to stay on their parents' health insurance until they're 26 years old. That's because of the Affordable Care Act. Before that, they could be kicked off by a health insurance company. You had no guarantee that you'd be able to stay after you turned 18. The Affordable Care Act ensures that people with pre-existing conditions cannot be thrown off of their insurance. There are, I think, 100 million Americans in the country who have pre-existing conditions. And remember, this isn't just like cancer or heart disease. This is asthma, migraines, depression and anxiety, substance abuse disorder. I could go on. Probably most of us who are on this right now have pre-existing conditions. And before the ACA, insurance companies could literally say, oh, you know what, you have that depression, you've been taking Prozac for a few years, we won't cover you. That's what it used to be like. And people with pre-existing conditions went bankrupt all the time. So the ACA has actually made that illegal. Companies can't do that anymore, and it has been a game changer. So what Vance and Trump want to do, even if they can't get rid of the ACA altogether, and let's remember again that that was one of Trump's main goals in his first term. All he tried to do, he tried over 60 times to get rid of the ACA, and the only reason it still exists is because activists throwing themselves into saving it, and I mean throwing themselves. And John McCain, thumbs down, that one vote saved our health care. But now we have a very different, set of Republicans in Congress, and there is no honorable person left on the Republican side, right? So they will be very happy to get rid of it. But anyway, what Trump and Vance can do, for one thing, one of the things Trump did when he realized that he couldn't kill the ACA flat out was that he just starved it, right? They stopped advertising the healthcare exchanges. They didn't hire any navigators, so there was no one to help people get on it. They just ignored it and hoped it would sort of fade away. And that's why the numbers of insured Americans dropped under Trump. Again, contrary to what J.D. Vance said. The reason those numbers have come up so dramatically under Biden and Harris is because they have done the opposite. They have fed the ACA. They have fed all of those navigators and put more staff in. They advertise. They tell everybody when it's time for open enrollment. And so we've got record numbers of people on the ACA. Biden and Harris really support the ACA. They want to strengthen it. They want to make it better. The other thing that Trump did is he brought in all of these what they call junk policies, and he tried to persuade healthy people to buy these junk policies. And Vance has a similar thing that he says all the time. If you're young and healthy, why should you have to be on these policies? Why should you be paying for, sicker people? So what they're trying to do is give them alternatives to come off of the ACA. But guess what happens then? Is that the premiums for the people who have to stay on get too expensive, and this causes what's called a death spiral, where suddenly the entire system no longer works. And this is their plan. So if they can't repeal the ACA flat out, and I believe it seems quite clear that they will be able to, because they will have the Republicans who will vote for that. But even if they can't, they can starve it basically until it no longer can function because they've convinced all the young healthy people to get off of it, luring them into junk insurance schemes that actually don't cover anything. It is a very serious moment. If you care about your pocketbook, oh, I know, I only care about the economy, that's all I'm going to vote about. Okay, well then you must care about the money in your pocket. You must care about whether or not you can get covered when you have an emergency in your life, which we all have. Under Trump and Vance, you are not going to have that. If you look up the Biden-Harris administration's record, you see that they have gotten it so that Medicare can negotiate drug prices. They have got a cap on insulin for people who are on Medicare, $35 a month. That's the cap that they will have to pay. $2,000 cap on what seniors have to pay for their drug costs. It goes on and on. All of that as well, Donald Trump and J.D. Vance want to repeal. They want to repeal everything in the IRA, and that includes all of those lowering of drug costs. So think about it. Think about your wallet, your health, the health of people you love, and know that Donald Trump and J.D. Vance don't care about any of it. Thank you for listening.